concerns that people might have about the vaccinations and answer some questions if those exist. So we are talking about the COVID vaccinations, of course, because that is the hot topic for the last couple of months. And the reason that we are harping on this, and that you hopefully are hearing your other healthcare providers ask about your COVID vaccination status, is just that this is the ticket to being able to get out of this pandemic. And this week, actually, I'm sure that people have heard, Connecticut and many other states have lifted a lot of the COVID precautions that have been in place as far as the recommended mask wearing in certain settings and some of the restaurant and other business capacity limits, which is great. But that definitely does not mean that it is behind us, because we're still seeing patients in the hospitals with COVID. That is surprising maybe, but I'll tell you that every single patient that I've seen for the last month in the hospital with COVID has been unvaccinated. Probably not a coincidence. There's been a lot of misinformation that exists, and it depends on how badly you want to find it. It's really important to pay attention to our sources and to try to seek out reliable sources when we're looking up information, especially in regards to healthcare topics. So historically, there's been a lot of mistrust in the US healthcare system. Unfortunately, politics has played a role in this over the last year or so, which really should not be the case, because science is science, and that exists whether or not people believe in it or whether or not they want to promote it as the reliable pathway to getting out of things like the pandemic. The COVID vaccines are very safe, very effective, and really have eclipsed our greatest hopes and expectations for how effective they would be and how safe they would be, and really how applicable they are really across the populations. So there aren't many groups that should be excluded from vaccinations, and I can tell you specifically who they are, but truthfully, everybody that is offered a vaccine should think hard about getting it. Ask some questions if those exist, but I would strongly recommend to everybody to get the vaccines. So there were some concerns about the safety profiles and the representation of minority groups within the COVID trials. The minority groups actually were represented pretty well. If you look at the specifics as to who was included, several of the trials were done multinationally, so some of them included populations in Asia, Africa, that didn't have a lot of typical Connecticut residents that you may see around present. It worked regardless of people's genetic backgrounds or pre-existing medical conditions for the most part, and I'll talk about some exceptions to that in a couple minutes. So despite the rapid speed of the development of the vaccines, which has raised a lot of concerns and questions, this wasn't really a rush job. They cut some administrative corners, not scientific corners, that allowed these vaccines to be developed so quickly. And really what it meant was that instead of the typical process during vaccine development, by which you have to get step A done and then regulatory approval to move on to step B, those regulatory steps were essentially eliminated, so we could be working on steps A, C, F, G, all at the same time. And when those results were available, due to the enormous collaborative efforts and money that was poured into this, they were able to put those pieces together much quicker than we're used to seeing. Still to date, I have not heard of a single person that has died from the vaccine. That is in comparison to the last time I looked at added up the statistics, I should say, was a couple of months ago, and by late January, the amount of US citizens that have died from COVID had already eclipsed those lost in World War I, World War II, Korean War, Vietnam War, and both of the Middle East wars combined. So vaccines save lives. They are the most cost-effective intervention as well that we could give in order to keep people out of the hospital and keep them from getting seriously ill. In this case, specific to COVID, but that is true for many other conditions. So this statistic that I don't want to skip over is indicating the Hispanic and Black Americans are 3 times more likely to be hospitalized or die from COVID than white Americans. And a lot of that has to do with access to medical care, mistrust in the medical system, comorbidities, but that still doesn't, the comorbidities don't necessarily account for the increase in the risk of hospitalization and or death in those populations. So you may ask, and I've gotten this question a lot, which vaccine should I get? My answer has been the same since the start. It is whichever vaccine you can get, and as soon as you can get it, truthfully. There was the issue where Johnson & Johnson had their vaccine administration temporarily put on hold due to a risk of a specific type of clotting disorder that may be associated with the vaccine. This was seen in a very specific age group, and that was essentially younger to middle-aged women. And at the end of the day, after careful review, it was determined that that may occur in up to less than 1 in a million cases, and that the risks of the vaccine are far outweighed by the benefits when you include the population level vaccination strategy that we're trying to get. So I'm just gonna breeze through a couple of the myths that have come up. Vaccine causes fertility issues. This is false. It does not. In fact, many, let's say several dozen women became pregnant and were breastfeeding during the trials, and there were 0 adverse outcomes pertaining to the vaccine reported. Vaccine, I like this one a lot. The vaccine is designed to control the population by injecting a microchip into our brain, if only that technology existed. But it's the silliest argument that I've heard from everybody that's walking around carrying a smartphone and indeed is subjecting themselves to a little bit of brain control technology just by looking at that the better part of your days. The vaccine does not have the capacity to alter our DNAs or incorporate itself into our DNAs. What happens is the vaccine, I'm gonna use the Pfizer and Moderna ones for example, are comprised of an mRNA, which is a messenger RNA particle that is essentially a protein by itself, which is not capable of replicating. In this case, that little protein represents the spike protein that you've probably seen on the diagram of COVID. That is enclosed within a small, they call it a lipid nanoparticle, but it's essentially mimics one of your own cells. Not too closely, because we actually want your immune system to recognize that as a foreign particle and take it up into one of your immune cells. During this process, it leads to development of antibodies and non-antibody related immunity to COVID. So despite the fact that this little protein gets brought into your cell, it does not go into the nucleus, which is where your DNA is replicated, and doesn't have the ability to touch our genetics. I think I mentioned this already, but nobody, as far as I know, has died from the side effects of the vaccine. Anaphylaxis is reported at a higher rate than the flu vaccines, but because of our knowledge of this that has come about during the trials, everybody's recommended to wait for at least 15 minutes or longer if you have a higher risk of developing one of those allergies. And all of the vaccine centers have EpiPens and other remedies on site in order to address that. COVID vaccine is not possible It's not possible for the vaccine to give you COVID, based on the fact that, as I mentioned, what we're giving you in the vaccine is not anything capable of replicating or incorporating itself to the point that it's going to cause those problems. If you've already had COVID, you don't need the vaccine. That is also false. Basically because the vaccine will enhance your natural immunity. And the evidence that we have so far suggests that people can be reinfected with COVID after a single episode of it. There were few but reported cases of this, including a handful within our system. So I want to pause, and there's a quote up here from Mr. Sims, who works at Hartford, within Hartford HealthCare, about why he chose to get the vaccine. Are there any questions to this point? Concerns? I think he makes a lot of good points as to why he chose to get it. It offers a sense of freedom, even if it's just within ourselves, and reassurance that we're not at extremely high risk of acquiring COVID, and especially lesser risk of passing that on to those around us, which I consider very important. You have a lot more opportunities based on the vaccination status, although that's still kind of being sorted out. So as of right now, I still don't know what a vaccine passport is, but those are being debated in a lot of different forums. At the end of the day, though, it is a safe and effective intervention to prevent anyone from getting COVID. As of right now, it's approved for everybody over 12, and there is no cap on that age limit. So everybody should get it that is eligible. I mentioned there is a couple populations where it's not necessarily contraindicated, but those with serious problems to their immune system may not get the same level of response and the same level of protection. And that's true with any vaccine. The people that we have seen that have been vaccinated and still have tested positive for COVID across the board are getting less severe diseases than those who are unvaccinated. And I'll say it again, the people that are coming into the hospital with COVID right now have not gotten the shot. And as health, normally I don't like to speak for others, but I think I could say this across the board, that as healthcare providers, we are sick of COVID, and we want everybody to be vaccinated so that everybody can make this more of a mild thing, similar to a seasonal influenza. We're still kind of waiting to see what shakes out with that, but this is really our ticket out. So there are a number of vaccine clinics listed. This is a bit dated just in the sense that we are likely shutting several of those down and transitioning the vaccinations to doctors' offices and smaller clinics. I think, I don't have the dates off the top of my head, but some of these will be shortly phased out. There is information at the bottom of the screen, though, in how to get yourself a vaccine appointment, and most of the healthcare providers should be pretty well adept at linking their patients into the shots at this stage. Any questions? That is all right. Yes, Bassem.
I have a question that was, my family is from Egypt, and I was talking with my aunt the other day, and she has, this season, she has the allergies kind of like what we have around here. And I get that every once in a while too. This year is bad for me. And her doctor was advising her to just pass this season because she's taking medication, and then start getting the vaccine for the COVID. And I was hesitant when I was talking with her because I'm in the same boat. I felt like maybe I should wait till this season passed too. So I don't know if that's, what do you think about that?
I would still say to get it as soon as possible. And maybe the concern was that the side effects from the vaccine on top of the seasonal allergies would be something that was intolerable, or maybe it was just that there may be some confusion if the allergy symptoms could mimic COVID, and in the setting of the vaccine, you might get some mild side effects, but I don't see any reason to wait.
Okay.
I was just wondering, is there any data now on how long this vaccine is good for? Is this something that you think that they'll be looking for us to have to get it every couple of years, or is there any information on that yet?
That's a great question. We have enough information to say that it is effective for 6 months following vaccine, but that's really the duration of follow-up that we have from the original study participants. So that information will be rolling out as we get it. As far as the need for boosters, it's not really clear at this point if it's going to be, truthfully, I would anticipate that at some point down the line we would get boosters. I couldn't tell you right now if that's because at some point our antibody level will get low enough. In many other vaccines that we give right now, we don't repeat them sooner than 5 to 10 years. And some of them, it's you just get a single booster and that's it. But we might be looking down the road, depending on what shakes out worldwide, at getting boosters for variants that have popped up that may evade the vaccines. And at this point, the variants that we've seen are still pretty well taken care of by the vaccines.
Thank you. That's good to know.
Sure.
Dr. Cahill, is there any progress on individuals who are younger than 12 years old being able to receive the vaccine anytime soon?
Yeah, those trials are going on. I think they're getting pretty close to being able to make a recommendation. We have seen that kids in that group are not frequently as affected, as is the case with a lot of the respiratory viruses. There is an inflammatory syndrome that has been reported in quite a few youngsters that, to my knowledge, is not very well predictable and not necessarily correlating with how severe their COVID disease was. But yeah, I think that we should get some information pretty soon about that group.
Do you think that will be Pfizer, or do you think Moderna and Johnson & Johnson might be able to start vaccinating individuals who are younger than 18?
Right now, we can do Moderna and Pfizer younger, like as young as 12. My guess is that if it were me, probably I would not administer the Johnson & Johnson one to young women, just with that reported risk of clotting disorder that may arise. And we still don't have enough information to say if there's some genetic marker we could test to see if somebody's likely to get it, but I would go with one of the other two, Pfizer or Moderna, in that group.
Unless there's anything last minute that any sort of topic anyone would like to ask about pertaining to the vaccine, we're just going to go ahead and close out this evening. Thank you so much, Dr. Cahill, for joining us this evening. This has been very, very informative.